I saw a nationwide survey finding that most retirees will unfortunately be paying a lot more for health care than they realize. Now, Dolph, when you do Where Do I Stand plans, you're putting together a retirement income plan. One of those line items is health care cost as they continue to rise, and possible long-term care cost as well. But how do you go about helping your clients really prepare for those expenses?
Well, I'm really fortunate to have a great agent, Jeff Conyers, with me as well. He's been with the team now for over a year. He specializes in the Medicare, long-term care, nursing home field of all that stuff, and getting to talk to clients about how important it is to, 3 words, know the facts. Mm-hmm. It's simple as that. Know the facts about Medicare. Know the facts about long-term care. Know the facts about nursing home. Because little mistakes can cost you a lot of money down the road. I mean, in the survey, healthcare costs toppled future retirees' list of financial concerns big time. Americans underestimate their cost in a big way, Kristen, when we're talking about Social Security. The average person at age 50 expects to spend about $7,000 a year in healthcare costs, when according to the survey, it was almost $11,000. Now, let's just do the numbers. If they're saying $7,000, you're a single individual and you live 30 years, it's $210,000 you're spending in healthcare costs. When in reality, they're saying it's a lot more. But if you're married, that's $420,000 in healthcare costs.
That's so expensive.
Correct. How many people have right now money set aside to cover potentially, and I'm saying this potentially because it's not for everybody, it's the average, $400,000 in medical care costs. On top of that, you have your cost of living costs, food, which we've talked about before, where the average married couple will spend almost $200,000 in food over their retirement. And when you can do the numbers of that, it's really simple. So all these numbers start piling up. Where's this money going to come from? Where's this going to come from? Have you figured that part out? When I've talked to some clients, and Jeff have talked to them, we've had things where you say, hey, you can create a medical annuity. And yes, it's an annuity, a medical annuity designed to cover your medical costs, protect that. For example, you can put like $225,000 in, and in some of these instances, you can get $10,000 a year for life for you and your spouse. So that will save you a lot of money come down the road. And if you think about it, I mean, for $225,000, you could almost cover all your medical costs for both of you guys and save yourself over $200,000.
Wow.
These are little strategies that we're talking about where if you're looking into the future to prepare for the future, you can save a lot more in the future. If you don't react now and you react later, it's all it's going to do is cost you more money.
On the Income Strategy Show with Dolph Janis of Clear Income Strategies on News 1110 and 99.3 WBT.